So hey guys, so I'm going to be walking you through the pathophysiology of heart defects with increased pulmonary blood flow. So this is a pediatric defect. It comes at birth and it can be asymptomatic and you may hear a heart murmur. Okay, so we're going to walk through this diagram. I don't have an audience, but if I did, you would tell me that this is a beautiful heart and this is a beautiful lung. Okay, awesome. So if I were to draw the 4 quadrants with my marker, you would clearly see that the 4 quadrants are right atrium, right ventricle, left ventricle. This is a beautiful lung. The blues are the pulmonary arteries. This is the aorta, the round. This is superior vena cava, inferior vena cava. Okay, and the 4 quadrants. This is a lung. Now, so atrial septal defect. That is an opening of the right atrium to the left atrium. So that opening occurs right to left atrium. That opening is, I'm going to put it in green. So that opening is right around here. So what is wrong with having an opening there? I'll tell you why in a minute. There was always an opening here in a fetus in mommy's womb when mommy was pregnant, and the opening was called a foramen ovale. So now, when the foramen ovale doesn't close due to reasons, it's called atrial septal defect. The atrial septal defect occurs is because of pressure. Everything revolves around pressure. Where's my blue marker? So in a fetus, the lungs are filled with fluid. So this is fluid. And why is the lungs filled with fluid? Because the baby is sitting in the amniotic sac. The baby's wrapped around amniotic fluid, so the baby's just breathing in all this fluid. So it kind of breathing in, and it kind of just sits in the lungs. But that's not a problem. This is our baby. If you guys remember from our last video, when the baby is pushed out the birth canal, the birth canal kind of squeezes the thorax of the baby, and then all the fluid comes out of the baby's nose. That's why how all the fluid is drained. So all of this fluid is drained at birth because of the vaginal canal squeezing the thorax of the baby, draining the fluid out through the baby's nose. So after birth, when something is filled, the pressure is very high. So think about something that's filled, like a balloon filled, a balloon filled that has high pressure. So if this is filled, the pressure would say, let's say the pressure is 200, right? When this empties, the pressure of the lungs is going to be knocked down to, let's say, about 100, okay? And pressure always flows from high to low. That's what you have to remember. Pressure always goes from high to low. So if this pressure is low, that means pressure to the lungs is low, then that means the pressure of the right side of the heart is high. So if the pressure here is 100, over here has to be at least like 101. So what's gonna say 115? So the pressure. If it doesn't close, then the pressure here is gonna remain. It's gonna remain like 90. And like I said, pressure flows from high to low. If the pressure here is 90 and the pressure here is 100, blood is going to flow back into the right ventricle, right? It's going to backflow, and backflow is never good. Backflow is never good. So for some reason, this didn't close. The pressure never changed 100 to 90. And then blood fills up in this, blood pools up in here. And then if blood is pooling up in here, it's going to be pushed out to the lungs. right? Causing excess blood in here, in the lungs. So blood pools up into the right ventricle, is being pushed out, and it's pooling up in the lungs. And then this is going to cause pressure to skyrocket, which is going to cause pulmonary hypertension. I'm just going to write it messy. I'm so sorry. So instead of the pressure being 100 here, it's going to skyrocket to 350, causing pulmonary hypertension. And that is not good. Okay, you can stop it. Okay. So the next heart defect with increased pulmonary blood flow is ventricular septal defect. So what is that? Similar to the atrial, it's an opening, however, it's in the ventricles. So this opening occurs, I'm going to do it in orange. This opening occurs between the left ventricle to the right. So this opening occurs right where my orange marker is. So what is the problem with this defect? Why is it a problem to have this opening? Well, in the green, I drew the pulmonary veins. Veins meaning blood flow coming from the lungs into the left atrium, left ventricle. It'll flow from the lungs into the pulmonary vein, into the left atrium, to the left ventricle, through the opening, causing more pooling in this right ventricle. So the pooling is just continuing in here. And if the pooling is continuing here, it'll back up more into the lungs. So it comes through the pulmonary vein, through the heart, through this opening, pooling up in here, causing more blood flow to the lungs. And if you know your anatomy, you know that this has oxygen, this has no oxygen. Well, low O2. So if the oxygenated blood is coming in here and there's an opening, it's going to go into the deoxygenated zone and then it's going to mix. So there's going to be oxygenated blood and there's going to be deoxygenated blood. It's just going to mix right here. The third defect is called the patent Ductus arteriosus. It's an opening from the pulmonary artery to the aorta, and I drew it from the pulmonary artery to the aorta. This is an opening, and the openings are supposed to close via or because of pressure. And because the pressure didn't change, that's why there was no closing. So everyone knows that the aorta sends oxygenated blood to the body, but instead of sending it to the body, the blood falls back through the PDA and then into the lungs. And the treatment for these are, usually they go away by the child is 3 years old. However, until then, they are treated as a CHF patient. Why are they treated as a CHF patient is because all of the blood is backing up. And if you know congestive heart failure, this is pretty congested.